nebulizer presentation I had. That video is very old, but I'm happy to go over these tips. Someone just commented on one of my old videos, "Oh, I can't hear very well." My name is Dr. Mkono. I hope you hear me better. I was sick when I was recording that particular video, but I hope that you can hear me. I do not have a mic, but I am happy to go over this on a live for you if you happen to be still around, touring on my video library. Nebulizers are so important right after discharge. You are given a lot of information. You're asked to follow up with your doctors. You're asked whether you're going to be getting follow-up images. You could have had a flare that was a purely asthma flare or COPD flare by itself. And it could have been, you know, flared up because you had flu, you had pneumonia, you had other types of reasons to flare, like congestion. Sometimes people flare because of weather change. Different things happen, and people get flared up in their asthma journey or in their COPD journey. The difference is at that point, then the inhalers are very hard for you to use because they are so they need timing and they need a good breath. And if you're having a hard time taking that deep breath, then maybe the videos that relate to inhalers may just be put to the side. Usually you get admitted in the hospital or you're seen in the ER, and we're giving you medications such as budesonide, which has a steroid inside, and we give you things like they have albuterol inside. This is albuterol and ipratropium inside, and then we give you things that has Euperli, which has the this is like Spiriva, basically like Spiriva or tiotropium. This is the long-acting type of medications that work different from the budesonide and different from the albuterol. Okay, so this person said, "Hey, I can't hear you. Let's set up a nebulizer together. You don't want the music in the background. Guess what? We all try to put some music in the background. I'm definitely not a professional editor, so I do the best I can. It's kind of fun, but it does require technique to edit your videos in time. I try to make the live videos because they're so much easier for me to make. And it can maybe educate you on how to do that nebulizer, which is really what you were looking for. And you didn't want to hear all that music. So when you get your nebulizer kit, it's going to go in a situation where you have a tube and a machine. And it really doesn't matter. They all have like a little knob right here. That knob is where you connect your tubing. And I want to discuss this tubing because this tubing can cause a lot of people. They've come into my office and said, "Hey, I don't know how to use the machine, or it's not working." This tubing is a source of problems if you don't get it together. Why? Because when you take care of these tubes, you sometimes have to um, wash your devices. And I do have a video on that. Hopefully that one is reasonable for you to watch and doesn't require an update. You need to make sure that this tubing comes out when you're washing your device and wiping it, because if you put water in here, then the pressure that goes on here will be difficult to release your air. Remember, this is just a pump. All the nebulizer machines these are pumps. We have little tiny ones too that are portable, and I'll probably go over that briefly during this video if I remember. But I'm just trying to go over the things that you will probably get overwhelmed, because in the hospital they connect you on this kind of mask onto the wall, but when you get home you have to kind of set up these devices, and they look difficult. I think personally, even without the manual you could set it up, but obviously watch your manual to see for sure how you're using yours. But it has a long tube like this. This is what I call the skinny tube. Make sure you keep it dry when you're washing it and taking care of it. That's a whole separate issue. Right now, we're just setting up. I just want to let you know all your equipment that deal with breathing need to be taken care of. And the way I would say, the simplest way to say to you is that take care of your nebulizer machine, because especially when you're sick, you're basically using these machines and you're putting bugs on them, like microbes on here. Once you're done, if you have money, you can toss this out. But for most people, you can
wash and recycle this. And there is a video that I show you guys how to do that. And these obviously can melt. So you want to make sure it's lukewarm and you wash it into that with dishwashing liquid. Some people use peroxide. Everybody uses different things. But I would say if you're going to rinse these off, that you wash it with something that doesn't get them to disintegrate. You're just trying to wash them like you wash baby bottles if you have babies. If you don't, then it's fine. Just use lukewarm water and put a little dishwashing liquid because it's safer. Make sure it's not scented because obviously most people are allergic if they're suffering from chronic illnesses. And therefore, such as asthma and COPD. So you want to make sure that it's very mild soap, and you can use peroxide if you desire. I personally think that mild soap with dishwashing liquid, running water would be the best idea because it keeps it safe and it doesn't have any corrosive smells and irritants for you. Anyways, so you get this tube and you get these pieces. You also get a mouthpiece and you get a machine, right? So if you're gonna get these three things or few things, you assemble them very easily. Look, they come and they can only fit one way. So it's, you shouldn't get overwhelmed because they are only going to fit one way. This fits here, it doesn't fit over here. So it fits right here. And then this fits right over here, right? If you're going to do the mouthpiece. If you're going to do the mask, because this is for the mouthpiece, let me show you so you don't get confused. It will go like this. This is the part that you will open and you put your liquid in here and make sure you just put it in the side there, right? We're gonna go over everything because this man said, oh, I'm assuming it's a man. I don't know if it's a woman. Oh, my video is too loud and it's too noisy. They can't hear, so I'm trying to fix that. Okay, because any kind of constructive criticism, we should take it seriously. And as people who are learning, are giving me feedback, I want them to understand that I'm here to try to help you understand, so I shouldn't make it difficult. If I'm going too fast, slow the video. But if it's loud and you can't hear, I can understand. You want it without any edits. You don't want any music in the background. So here we are. I'm responding to that gentleman who said my old video Nebulizer was not going to cut it for him. He made a comment and I was like, what? I'm tired, but I'm ready to just let him know that we can go through this. Plus, I'm going to give him a tip. If he's coming from the hospital, if he's having a flare, I'm going to take care of him today. This video is going to cut it. I hope that they will involve their doctor and make sure what I said is correct because I don't know them, but they're looking for a nebulizer, maybe for themselves, maybe for somebody else. We're going to set it up together. So here we are. This is the mouthpiece, right? This is just there to kind of get the mist out of the way. This is the two things that you will just connect. And this is where this tubing goes, right here. Right here. And then this here goes over here, right over here. Boom. You twist it in. And now we have it all set up, right? So simple. If you do not like mouthpiece, I personally like mouthpiece, but I don't know how everybody feels. You can use what's appropriate for you. I would assume for kids, elderly, people who are, frail, you would want to use something like this. And you stick this right here and you put it over your head like this. Okay? So it's your preference how you're gonna do it. Okay? You do it the way you do you is what I would say. Okay? But there is versatility to this. There's sizes. Some people have small, big. You can look Amazon. I actually have a link for you guys to look at some of the things I show on there. Also, Amazon, I teach how to use these nebulizers, what to buy for those people who do not know what to buy, but you don't have to. You can get it from your prescription, your providers, your medical supplier, your Amazon, your Walmart, your whatever you want to use, you can use. But when you do buy it, it comes, and these are pretty much very similar and usually very interchangeable. You buy this piece, it fits properly right onto the machine right there. Now, the nebulizer, if you understand this, is very simple to use, but I have to tell you, these are really strong. They're strong. They're meant so that when you are asked to use that rescue inhaler or an inhaler, it may be tough for you to do the dynamics of all this, like shaking it up. You're sick and you're coughing, you're hacking, you can't even take a deep breath. Somebody telling you to do this and then spray, that's your prime. Do this and then go That's pretty unreasonable when you're sick. If you're having an attack, you're coming from the hospital, they've just given you a bag of all these kind of things to you, and you're thinking, oh my Lord, that I can't do that. We know that you can't do that. That's why in the hospital, we are busy giving you nebules. This is, like I said, if you're going to watch from the beginning, I've gone over that we're going to be doing nebulizer therapy. And that is because it's so much easier. It's very different than when we're doing um, when we're actually giving you deeper medications through inhalers, right? This now, we're expecting you to be using nebules. These are nebules. And they come in, and don't say they're all the same. They're not. Because some of them have albuterol, they'll make your heart race. Some of them have like what we call ipotropium or tiotropium. They can make some people have urinary retention. And therefore, you need to make sure you understand what's inside this. What I really love sometimes to give patients who have a lot of secretions, and I don't want to give them any medications inside of it, that's between you and your doctor. I give them 3% or hypertonic saline, which is basically sterilized saline. Please don't go and make your own because we don't want you to get to inhale the wrong things, okay? So these little things, they're called nebules. You would break one apart, right? Depending on what your doctor said. Now you have to follow that prescription because especially when I do it, I say to you, take your nebulizer and I say budesonide. This is how it looks, right? And you would take this budesonide and I would say, take it twice a day until you're better. And I'll give you a stop date, of course. And then I give you pills. We give you the steroid pills, right? I don't know if I have those pills in here, but I'll give you steroid pills. What I'm trying to do with that is trying to take care of your flare. It would be nice if I had it, but I don't seem to have it. Okay? Doesn't matter. You know how steroid pills look like. So you would take your little nebule right here, okay? And you have your plan. You're going to take your steroids, your antibiotic. The steroid pills now have transitioned to pills. In the hospital, we may have been using IV. We now transition you to pills, and we maybe are breaking it down and saying take, 6 for, 2 days, and then 5 for 2 days, and then 4, then 3, then 2, then 1, then come off. And meanwhile, we are also saying, go ahead and take an antibiotic, go ahead and take a nebulizer, and then we give you the sequence. Now, you don't want to go crazy nebulizing with albuterol every 6 hours because when you're home, nobody's watching your heart. We'll advise you to start backing off on it because if you're better, only reach out if you need it. Now, follow your doctor's directions. That's what I tell my patients. I'm not monitoring you. There's different age groups, some older, some younger. Especially the older, they can get palpitations and arrhythmias. So we don't want that to happen to them. We want to make sure that everybody is safe. So I am trying to say to you that it's not one size fits all. Some people we give nebulizers to, some people we don't. But if we went and gave you a nebulizer in the ER, I would suggest you tap that doctor and say, excuse me, on the way out, when I go home, I don't have a nebulizer. Can I get one? Because the flare could be ongoing even though they gave you steroids shots or IV or pills. It will go on sometimes 4 to 6 weeks. As long as it's getting better, that's good. And I will also link up with a doctor. Why? Because they can see whether you're on the decline to coming back to earth from that flare up that took you all the way to the sky. You're coming down nicely with the steroids and you're coming down nicely with the nebulizer and you're sticking to the regimen schedule. Remember, with nebulizers and inhalers, we have a specific schedule we give you. If we say as needed, that means it's optional. If we say scheduled, you need to keep that schedule, okay? Because if you don't, then obviously the medications won't hold its therapeutic level. And then we're going to be dropping and just be all over the place. So while we are talking about this hospitalization, one of the biggest things I should say is that yes, nebulizers work, but you know what? Some of you really just need to take your inhalers, and that's why I'm here, to make sure you understand that most of you get the inhalers wrong. But let's stick to the nebulizer because this is what we're going to be doing. We're going to be putting this nebulizer in here. Well, if your doctor said you can mix yours, you can mix them because sometimes they're giving you a budesonide, then they're giving you a Pearly, and then they're giving you 3% and hypertonic, they're giving you albuterol. By the way, these are all in your inhaler. We are substituting them here so you can easily breathe them into your lungs. And this breath is different than the inhaler breath. So you twist this back, right? You are going to turn this machine on. It's got an on-off button right here. And here we go. right? And voila, we have it. So you choose which way you want to do it, but if you want to do it like this, you just take slow breath on here. You're not going, you're not doing any of that. That's inhaler. This is nebulizer, right? So you're gonna do this nebulizer until all this liquid goes. And once that liquid is gone, then you would go to, if you're doing it in sequence, you'll go to another one. I mean, it can take, sometimes it depends on how much liquid it has to evaporate. This is why it's so important that everything is sealed nicely, and this is a pumping device. If it blocks with liquid, then it's not gonna work. And then your nebulizer is not working. Then you're home and you're panicking, what do I do, what do I do? Just make sure that this tube right here stays dry. The liquid stays in this container, doesn't get through this tube, this little centerpiece, because we're only blowing air out of the machine to here to make it misty, this mist, right? And if you do not like this mouthpiece, or your child doesn't like it, or your grandparent doesn't like it, or your loved one doesn't like it, your patient doesn't like it, put it here. Do the mouthpiece like this, right there. Same thing. Shallow breath, back and forth, in and out. You do it until all that liquid goes. I'm not going to do that to you because obviously you guys will run away. You already are. And I'm trying to teach you guys everything you need to know about the tips I would want to know, or my patients should know when they come see us. If they're leaving the hospital, if they're leaving the ER, if they're leaving the clinic, and we give them a nebulizer, realize that we're giving it to them because we're assuming, well, sometimes it's financial. You can't afford the inhalers. We give you this as a bridge because you can't afford the inhaler. But for the most part, most people get these because they cannot breathe deep enough to do this motion that we discussed with inhalers. Differentiating your inhalers, I did a live earlier today. Please go and take a look at that because I'm going over inhalers in that one. This one is just to show you the dynamics of how I expect you to use the inhaler will be completely off because you're sick. Now, you will say, well, I can use this. Yeah, sure, you can. You can use a nebulizer into here, I mean, your inhaler in here, and that works. You and your doctor, you do you. But I think that if you're coughing, hacking, you've had a pneumonia, you've had respiratory failure, you're on oxygen, you can't breathe, you're miserable, making you use an inhaler would be completely like coughing it out, which is exactly what we don't want you to do. Uh, you're coughing it all out, you see? It comes out, right? You need to hold that breath like this. Shake it up. For those providers out there, you know your patient cannot do this. For the patients, you know you can't do that. You can't hold your breath that long. So yes, we went through this nebulizer setup and we set it up from the beginning to the end. If you want to go backwards and take a look at that video, see the tips I provide all along. It's so important because when you get sick, you may even have phlegm. That's a whole different topic. We're talking about getting rid of that phlegm. We have a different video for that. You guys should look that one up too, because keeping the phlegm inside your lungs will definitely make you get more pneumonia, even though you had it, and it attracts more infections. So it's very important that you clear that phlegm and you find out from your doctor, is he or she giving you a budesonide, which is scheduled usually? This is substituting for a nebulizer steroid inside. This is what budesonide is. And then this is albuterol. It's substituting for your rescue regimens. Or your COPD and asthmatics sometimes have this, and you're using it on a regular basis when you're sick. But once you're done, you're probably going to be converted to an inhaler that includes all that you need inside of it. If it's just steroid, then you'll get one that has steroid alone. If it's steroids with albuterol, which is common for asthmatic, maybe not so common with the COPD, but they could still have it, then they're on that. Just remember, whatever inhaler you're on, understand the role. There is a maintenance inhaler and there's a therapeutic inhaler that which is the maintenance inhaler. And then there is a rescue inhaler or a quick reliever. Make sure you don't mix them up. and start using your rescue inhaler as your maintenance inhaler, because that's not how things work. You need to build your maintenance inhaler so that it works. Oh, okay. All right. How do you do that? I was just actually playing with that. Anyways, I just want to make sure that we oh, answer will appear here. Okay. So I would put nebulizer, I guess. Nebulizer setup. How to set up a nebulizer. Set a nebulizer. Everybody, so this is a good question, right? Yeah, so that's it. So this is a good thing to do. And then for those people who are trying to answer it, I guess you can, I can try that out. I was just trying that out. Okay. So I don't even know how to get rid of it. But meanwhile, I just want to make sure that you guys know how to do this, and you know how to set up everything, and you know how to use everything. This is the question for today, and somebody said my video wasn't right, so I'm trying to fix that problem by making you a live video without edits and without any background noise. Hopefully this helped you and it provided you more than you needed, giving you tips about asthma COPD management with nebulizers. The role of nebulizer is to help you bridge over, hopefully back to your maintenance inhaler, which is what's keeping you away from the hospitals, hopefully. If you have a good regimen, it should work. And if you don't know the answer to that, please just start from the beginning. Or if you don't like that, then watch the videos I have on either TikTok. I have plenty of videos there teaching nebulizers in all sorts of ways, inhalers of any sort. And you should get your technique down. But before you go, please make sure that the technique is not the last part. It's the beginning. Technique needs to come first. Make sure you hold that breath, hold it for 10 seconds, exhale, and then take your next puff if you're due for a next puff. Schedule your medication, set yourself up to win, put your nebulizer and your inhalers next to your toothbrush if you're really going to be going there twice a day. Don't forget to gargle your mouth. Like this budesonide, I think personally, if I'm taking it, I would be advising you to rinse your mouth after use. All these things are very important. Just make sure that you are actually, don't ask me why I have this, because I just put it up there and I don't know how to get rid of it. So I just want you guys to know that I am here when you need me for the basics, and you do need to involve your doctors for the deep dives. I'm going to be going over these things and sending these videos over to my patients who ask me lots of questions and delay me every day. So I plan to use this library no matter what, whether you guys are listening or not. It will be put to good use in my office, because I repeat myself all day long. And most of you get overwhelmed and you go home and then you call back and say, wait, what did you say? I need you to put Dr. McConnell on the phone again. That's not going to happen. I have to make it home and write those notes and do everything else that we usually do. And then if your inhalers, nebulizers are having a hard time going through the pharmacy, make sure you realize that there are different resources of where you can get nebulizers. Amazon is one. I definitely have a shop that you guys can take a look at if you're interested in knowing what else you can get from Amazon. It's a lot. Plus, you can get your scripts there if you want to get your scripts through Amazon, but you can also get any of these supplies. You don't need to go see your doctor to get a nebulizer machine. You can get one right in your own, in the comfort of your own home. Okay. Now, before we go, I want to go over this type of nebulizer if it works, of course, because I don't remember charging you. It's been a long time. I want to go over this, which works pretty much the same as a regular nebulizer, but it is portable. So for those people who need a portable device, you can use this, right? Too many toys. But it has a mouthpiece that we have to stick. I'm gonna find it. Maybe I may not be so lucky. Oh, there it is. That has a mouthpiece, and you just stick these right here, and you turn it on. Mine is not charged, but I guess I could charge it for a few minutes so that you guys can see. If I could find it. I can charge it maybe and see before we go. Maybe I can try to see if I can show you how to use this. Oh yeah. Oh yeah, it's charging. So this is the beauty of this. So you could do the same thing that I just showed you guys how to set up a nebulizer slowly. You can do it with this portable. And the beauty of this portable one is that they're small and there's so many people who make them. They don't last that long. I would say it's a good one for travel if you're going somewhere. But if you are on the go, maybe your doctor has released you to go back to work, or you're on the go, your kids are on the go, whoever is using this, it's good and handy where you're not taking this bulky machine, which works better, of course, all the way through your whole life everywhere. You would just carry this little charged up machine. You would put your little liquid right over here and you turn it on and then you would nebulize. So that's a good handy thing to maybe make sure you get. And you can get that from maybe Amazon also. Okay, so you can look at what I promote, or you can get whatever you want from wherever you desire. Get a portable if you need a portable. Get a full machine. I think you should have both if you're suffering from asthma or your loved one is. Have both because these are really durable and they work for a longer time. I've had this machine for a while. I've had some of them for 20, almost 20 years. Yeah. Mm-hmm. That's a long time. Anyways, I would rather you know that you should get both. Don't just get a portable and you're sick. I think if you can get both, maybe a portable while you're waiting for your main machine to come, or get filled at the pharmacy. So hopefully for the person who asked me all these wonderful questions today or said a comment, I was able to give them a video that gives them information about how to use a nebulizer, how to connect it, how to use it, how do we utilize it, what is the purpose of it, because basically it's giving you the same things as what you have in your inhaler, only it's safer because you can do this much more comfortably on a nebulizer when you're sick versus an inhaler, which would be unpredictable if you get it in, if you're coughing, hacking, and sick from pneumonia or respiratory failure or all these other things. By the way, if you control your asthma, you have less flare-ups. If you control and protect your lungs, you would definitely have less infections and less flare-up, less hospitalization. If you use your inhalers the way they've been prescribed, meaning you know which one is your maintenance and you're applying it if it's twice a day as it has been prescribed because your doctors know best. They said twice a day for a reason. You shouldn't be using it as needed, or sparingly use it and switch it around thinking they're the same thing. Some inhalers look the same, but they are not. So make sure you have your schedule right so you can set yourself up so you don't end up in the hospital again. Pretty much for poor control. If you have poor control, how do you sound? You wheeze, you keep getting bronchitis after bronchitis, you wake up at night, rescue, you hog your rescue, you think everybody's infecting you, meanwhile your lungs were not right. So I just hope this helps and gets you guys all squared away. And your inhalers are very important and they matter. So make sure that you get it all squared out with your doctors as to which inhalers you're supposed to take. And if you have discarded them or refused to pay for one, it's way cheaper to pay for the inhaler once we figure out what's cheaper for you on your plan. Get your prescription details from your insurance as to what is preferred on your plan. That's way cheaper than getting hospitalized and ruining your whole life and interrupting your life continually because you didn't know you're supposed to be on your inhalers on a regular basis. And I'm talking about the maintenance. I'm not talking about the rescue. I'm talking about the maintenance. And yes, steroids work, but they're not going to work for the long term. You should really be on a nebulizer or an inhaler, preferably for your lungs, because we shouldn't be giving the whole body steroids just because you do not know that you should be using your inhalers. That doesn't make sense. Your inhalers are the safest place to give you your medication. But when you lose out on that and you don't get your inhalers in your lungs, we definitely have to give it to you in the IV, in the pill form. Why? Because we're trying to hit you really hard because you're behind, and we're probably going to give you everything you missed years ago back to you all in one go, maybe in a series of a week. And that's really not the safest way to do it. It's much better when we give it to you in powder form, mist form, nebulized into your lungs. It's almost like depositing it on your skin versus injecting it into your body, your whole body, including your eyes, your bones, your, buffalo hump, and everything else that we could talk about on a different topic. Take care, okay? I hope everything I said helped. And again, it's Dr. Mukono, and I hope that answers the person who had a really horrible time listening to one of my old videos, which I thought was doing good, but I guess it's not. It wasn't to par. But hopefully this one is. Take care.